Hi! Welcome to their channel. This is Dr. Jean Marquez and ngayon pag-uusapan po natin ang isa sa pinaka-common skin problem na na-encounter namin sa panahon ngayon. Ito po yung tinatawag na Maskne. Ang Maskne po was coined recently during this COVID season kasi nga po madalas tayong nagwe-wear ng mask. This is actually just mechanical acne, no? Itong mechanical acne is an irritation, starts with irritation, later on it can cause acne breakouts. It's important to wash your face before putting mask. It's better to use a mild facial cleanser lang. Because if you're using mga exfoliating cleansers like yung mga matatapang na whitening soaps or mga soaps that can actually peel your skin, this can actually cause inflammation in your skin. Your skin can be more sensitive to dust, to sweat, and to the mask itself, no? O dun sa friction na nadudulot ng mask. Or dun sa chemical na meron ang mask. Also, if you're using mga strong exfoliating creams and astringents that can peel your skin, or if you continuously are peeling your skin, no, it's better po na medyo iwas-iwasan muna. Of course, kung hindi nyo maiiwasan, meron naman po mga mild exfoliating creams, and if you really don't need to peel, wag na lang po muna, no? But kung talagang gusto nyo pa rin, bago po kayo mag-mask, stop muna all this medication for mga 3 days and let your skin heal muna, no? Huwag munang nagtutuklap para pag naglagay kayo ng mask, hindi po mai-irritate ang inyong balat. Alright? So also, if you're gonna use mga cleansers po, wag po muna tayong mag-facial scrubs, no? Because if your skin is sensitive, pwede pong mamula, ma-irritate. Tapos pag nag-mask ka, this can cause further acne breakouts and irritation. So what else can you do to protect your skin from this maskne na tinatawag? You can actually also use moisturizers that are oil-free or moisturizers that are good for acne-prone skin, no? Ito po yung mga moisturizers na pag nilagay mo sa iyong face, mabilis siya ma-absorb, mabilis mag-dry, no? This can actually help protect your skin from touching the mask. Of course, meron siyang barrier, no? And actually, it can also protect you from dust, from irritation from sweat. So, nakakatulong din po yan. Especially if you're using mga acne medications which are potentially irritating to the skin and drying, it's a must that you use actually mga moisturizers. But take note na may mga moisturizers naman po na nababagay sa acne-prone skin. Kapag naglagay kayo ng moisturizers, make sure to let it dry first at huwag ka agad magsuot ng mask, no? Para po maiwasan na naman ang sobrang humidity dito at makulob naman po at maiwasan magkaroon ng mga bacterial infection and of course mga acne breakouts as well, no? Another thing is it's important po na to bring an extra mask with you kasi kung soiled na yung mask na yan, madumi na at meron na siyang saliva, may naubuhan mo na siya, tapos meron na siyang oil, kumapit na, and then the sweat. It's very important that you have an extra mask with you. So, palitan nyo yung mask ninyo agad kasi po, pwede po kasing ito'y maging breeding ground for bacterial infection and of course, later on, inflammation and acne breakouts or other skin conditions. Another thing that you need to do is to, of course, wash your mask na tela, no? So, yung mga super sensitive ang skin, who have dry skin, who have allergies in the family, or meron kang allergic rhinitis, asthma, bahing ka ng bahing, no? Or mga allergic conditions, usually, yung mga ganitong mga individuals are very prone to develop allergy from fragrance, no? So, kapag gumagamit tayo ng detergent, no? Pwedeng ito'y masyadong matapang. This can actually cause irritation in your skin and also acne breakouts. Body wash and facial wash are designed for the skin. So, it's more soothing and also better to wash your mask with these soaps para hindi masyado ma-irritate ang inyong skin from the fragrances or the chemicals from detergents. And kapag meron ka namang acne na, so anong pwede nating gawin? Of course, may mga topical medications that your dermatologist can prescribe, and of course, oral medications, mga iniinom din, no, in the form of vitamins and or supplements, and also mga antibiotics or mga pills, and also may mga isotretinoin na pwedeng binibigay ang mga dermatologists. Ngayon, kung hindi pa kayo makapunta sa dermatologist, if you're not sensitive to it, you can probably use muna benzoyl peroxide. And we recommend a low-strength benzoyl peroxide lang muna para sigurado hindi kayo ma-irritate, mga 5% o pababa. But if you start to experience some stinging and redness or pamamaga, you stop it muna, ipahinga nyo. Then you try to reapply mga after 3 days or until you see your dermatologist po. No, ngayon, do not experiment on using a lot of products muna kasi baka sayang ang inyong pera. So it's better to consult your dermatologist. Marami po tayong mga dermatologists who do online consultation nowadays. And of course, if you're gonna read about acne, make sure that you're reading it from a reputable source, no? A dermatology website or a dermatology association website like the Philippine Dermatological Society, American Academy of Dermatology, and the likes po. Be sure na maganda at reputable ang inyong source, no? Kasi kung hindi, baka lalo po kayo mapahamak at lalo lang po kayong mapagastos, no? But yung mga pamahid po yan, all these kinds of treatments, we are gonna talk about that on our next YouTube video. So, for now, yan po muna ang ating ituturo. Marami pa po tayong pwedeng sabihin, but our time is short. And of course, kakain na po ako dahil 12:00 na po. Kailangan na rin po tayong magpalakas. Until next time, this is Dr. Jean Marquez of their clinic. Please like our Facebook page and also like this video and subscribe to our channel. Until next time, God bless you and stay safe. Bye!